Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do. When someone has a question about chiropractic or chiropractic care, I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Thanks for tuning in for another episode of Ask the Chiropractor. Today I want to talk about the very bottom disc, the L5. We have a lot of people come in and tell us they have L5 disc issues, or I've been told I have an L5 situation, or I had x-rays taken somewhere else and they told me I have an L5 disc bulge or herniation, whatever you might have heard. Let's talk a little bit about the L5, because I think the L5 is one of the more unique spots in the spine. So I've been a chiropractor now since 2002, and I'm recording this, it's 2025. So I've had 23 years plus my time in college looking at x-rays of people's L5 disc. And I want to tell you a little bit what I've seen, what I've noticed, and a little bit just overall about the L5. So first of all, what is the L5? L stands for lumbar, and lumbar are the 5 bones of your lower back. And the fifth one would obviously be the fifth one down. The L1's the top one, then 2, 3, 4, 5. Real easy math. So the L5 is right before the sacrum. Some people call it the tailbone. And the sacrum and the L5 have a disc usually in between them. Now I say usually because this is one of the most common places to have an abnormality of this disc in the spine. You see, when you're a child, your sacrum isn't 1 bone, it's actually 6. And as you go through puberty and you grow, the sacrum actually starts to grow together and the disc dissolves and it fuses into one giant bone. And right above it's the L5. Now, the nerve that comes out of there is the L5 nerve. Let's talk a little bit about this fusion of the bones. You see, clinically, I've seen over the years that people, especially people that played hard outside, or like myself, I was in high school and there's 3 brothers that lived a couple doors down from me, and we played pretty hard. I played tackle football. I monkeyed around with my friends playing lacrosse, and I was a wrestler in high school, and we just played a lot of physical sports. Even in middle school and elementary school, I can remember getting in trouble for playing King of the Mountain on top of a snow pile at school. All of us boys that were playing, all of our mothers were called because we're not supposed to play that game apparently. So I used to play a lot of rough stuff. A lot of people that do this stuff, or maybe at a motorcycle or horseback riding, when you go through puberty and these bones start to fuse, sometimes the L5 will actually start to fuse with the sacrum, as if it's a larger sacrum now. But usually right before it's done fusing, it'll stop. Now what happens here is it creates what we call a rudimentary disc. So the disc starts to flatten and go away because it thinks it's going to fuse together. But for whatever reason, at the last minute, it'll stop. Now, when it stops, we end up with a rudimentary disc, a thin little sliver of a disc that you would normally have. But the backside of the vertebrae has a joint called the facet joint, F-A-C-E-T, facet joint. And a lot of times these facet joints will also start to fuse or come together or lock up in the sacrum area. Now, typically when I see this on the x-ray, I think to myself, there's an L5 that's never going to move because it's already trying to fuse with the sacrum. The back side of the joint, where those facet joints are, those are starting to interlock more than normally would. And it's starting to really lock itself into place just through the bony structure. So how do we know this is what happened and you don't have a blown out L5 disc? Because you have to imagine when a disc starts to dehydrate and starts to go away, it flattens. So how can we confidently say that this is a way you were born, raised, and grew versus this is a really bad degenerative problem? A couple of the clues are simple. Whenever you have the misalignment like that and the vertebrae get misaligned, we call it a subluxation. Now, when the subluxation is there, it means 1 or 2 bones are misaligned, affecting the nerve coming out wherever that nerve goes under stress. The stress response kicks in. So if it was your L5 nerve and you had a subluxation down there for a long time, that innervates a lot of your foot and your lower extremity. You see, the L5 nerve is part of the sciatic nerve. Several levels of the lumbar spine come out. They exit the spine individually, then they come together and they form a nerve about as big as your thumb, and that goes through around the piriformis muscle down the back of your thighs into your knee down, everywhere knee down does the sciatic nerve. So if you have hamstring problems, if you have anything knee down, you're thinking sciatica. So part of the sciatic nerve. So if you had a subluxation at L5 for a long time, you'd have issues with your sciatic nerve. So if we x-ray you and that disc is really thin and you've never had any kind of sciatica issues, then it's kind of hard for us to think that this is probably a sciatic issue and this is probably nerve from a subluxation causing degeneration. Another huge clue is if it was really that thin, what happens is the body starts to undergo the arthritic process, or to start putting more calcium down on these bones. I always describe disc degeneration kind of like bony calluses. You see the disc goes away and the bones get closer together and there's rubbing and friction. So the body starts putting down more and more calcium in this area to help straighten the bone. Unfortunately, this calcium grows someplace we don't want it to grow. It actually hits the nerve and irritates the nerve constantly. So when you get this thin disc, we expect to see calcium buildup. Now in the x-ray, you can actually see when there's more calcium buildup because the spot's actually whiter. The calcium will build up on the x-ray. We'll see the bone. We'll see a big brim around the bone where the calcium is built up that's wearing and tearing. So when I see that, then I suspect it's been a disc problem for a long time. When I see a thin disc like that, I don't see any changes. Then I know this hasn't been a long-term issue because the bone hasn't changed. But you can't have that thin of a disc happen overnight. It takes time for that disc to thin out. So if the disc is really thin and there's no extra calcium put down there, I'm thinking more and more this is probably just a change of the way you grew more than a degenerative, real bad disc issue. The other clue is if I look at the sacrum itself from the side on the x-ray, and I see little rudimentary disc in there too, then I know there's another clue that the normal puberty changes of the sacrum and the lumbar spine weren't as typical, meaning that you probably played hard and tackled each other, fell down, and it's more likely this is a disc that never fully grew. Now, it's really easy for me to use a fear tactic or a sales tactic to look at you and say you have a really bad L5 disc. There's no height here. But if I don't have any complaints of sciatica ever, if I don't see any issues with the bowels, because the nerves also go to that area, and we don't see any extra calcium deposits there, and maybe we see some sacral changes, then I have to suspect that's just the way your disc grew. That's just what's going on. You see a lot of people that come in, they complain about their L5, or they've been diagnosed with having a bad L5, when they're really having SI problems. I tell them, why don't you point where it bothers you? And they don't point at the L5. They're pointing at the SI joints. And what are the SI joints? Well, the SI joints is where the sacrum, the tailbone, and the hip, the ilium, come together. And they're right next to the L5. So when someone says that hurts over here, hurts right here, and I put my thumb right where they're touching, and I realize it's an SI problem. I've done many videos on SI issues where a lot of times it's nothing to do with the SI, it has to do with the upper lumbars. It might be an L1 problem, actually, and they're being told they have an L5 issue. I've had many patients over the years that have had shots and they've had nerve ablations at the L5 for this issue, and they don't get any relief. But then I find out it was actually an SI problem, and I go up and adjust the upper lumbars, and they finally get relief. And I don't even touch the L5, even though they've had shots, they've had nerve ablations, everything going on there. We get good relief by looking higher up. So how do we know this if you come in the office, what your situation is? There's only one way to know, and that's to take films of your spine. So if you have films of your spine, you can bring them in with you. We can always look at those films. We don't always have to take new ones. X-ray of your lower back is an X-ray of your lower back, regardless of who took it, as long as you were standing up in the X-ray. If you were laying down in the X-ray, then your chiropractor cannot use those X-rays to determine a lot of the chiropractic issues that we look for and evaluate. We can still use them to diagnose the fact that you don't have a fracture, you don't have a tumor, you don't have this. They're good for that, but what they're not good for is looking at your posture and seeing how you carry yourself, for the simple fact you're not carrying yourself, you are laying down. So if you've been told you have an L5 disc problem or an L5 issue, it might be beneficial to ask a chiropractor. Now, you can ask whoever told you have an L5 problem whether or not you should ask a chiropractor, and that's a really bad idea because medical doctors, nurse practitioners, family doctors, orthopedic surgeons, they don't study chiropractic like we study chiropractic. They don't know what we know or know how we know what we do. Just like I wouldn't know how to perform back surgery on you. I might know the spinal anatomy very good. Matter of fact, I went to Palmer College of Chiropractic, had Mr. Mortar one of the hardest teachers Palmer College ever had. And I passed this class, so I know the spinal anatomy as well as anybody else. But I have no idea how to do a surgery. So if you ask me how the surgery works, I have an idea, but I don't know enough to give you solid medical advice for you to make medical decisions about. No more than your family doctor knows anything about chiropractic. So ask a chiropractor. And if you went to a chiropractor that took an x-ray of your lower back and tells you have an L5 disc problem, but you haven't had some of the things I'm describing, it's okay to get another opinion too. So make sure you don't spend too much time working on the L5 if the L5 is really not the issue. Again, if there was one disc that people come in and tell me they have a disc problem with, then I would bet that's probably going to say the L5. They probably really don't. It's probably something else. I'm always thinking L5. So if you have questions about your L5 disc or anything else about chiropractic, the only person qualified to answer these questions is a chiropractor. Make sure you find yourself a chiropractor, ask them. And if you have a question about chiropractic or chiropractic care that I might be able to answer for you, leave a message or a comment wherever you're watching or listening to this, and maybe next week you'll be the question of the week. Thanks for tuning in. Make sure you like, share, subscribe, and all that other good stuff. Thank you.